Hi, Alvin here, and welcome to episode 9 of the 3-Minute Health Tip. In this episode, I'm going to be discussing pain management strategies. What do you do to help reduce your pain? Well, there's really 3 steps that I've identified that I really recommend to a lot of my patients. Step number 1, you have to identify the trigger. Why is your pain worse right now? Why did it flare up? Why is your shoulder feeling worse at 4 p.m. rather than earlier in the day? And so one of the things that we talked about is identifying the tracks or the triggers that remind you of the original conflict. Was it a comment somebody said? Was it a particular person that emailed or texted you? Was it something in your environment that reminded you of the original conflict theme? So step 1 is identify why it's flared up right now, because the ability to do that will reduce any anxiety or nervousness around why the pain is starting to come on again. Step 2, rate the pain on a scale of 1 to 10. 10 being excruciating pain and 1 being mild pain. So I need you to start to become in tune and aware of how your body is feeling. So this is really a subjective measure of your pain. So when the pain flares up, you ask yourself, how bad is the shoulder? It's like a 7 right now. And then you think about, why is it showing up right now? Well, it could be that, I ran into my ex's sister at the grocery store, and perhaps that triggered that relationship situation that I haven't officially closed yet. Second step, rate the pain on a scale of 1 to 10. The third step involves you taking out your pain management protocol chart. And what this is a chart that I'm going to ask you to create yourself right after this video. And what you're going to do is you're going to have 3 headings. One heading is 1 to 4. The second heading is 5 to 7. And the third heading is greater than 7. And these are your pain scale ranges. And what you do is under 1 to 4, you're going to list a few things that you know can reduce your pain by 1 level. So that could be going for a walk, it could be doing yoga or meditation, it could be calling up a friend, it could be watching something funny, it could be perhaps taking something that you know helps to calm you down, okay? So that's under that first column of 1 to 4. The second column of 5 to 7, again, you list a few things that perhaps when the pain is a little more intense, you need to involve yourself in. Maybe it's seeing a massage therapist, going to see your physio or your chiro or acupuncturist or energy practitioner, or perhaps it's actually taking something, a remedy or an over-the-counter medication that can help reduce that pain a little bit. Then when it's greater than 7, you have another list of different items. Perhaps this is when you go to a walk-in clinic. Maybe it's when you get a prescription medication or you use cannabis oil. Whatever it is that you feel that if I do this, it will reduce the pain by 1 level. And you have that protocol chart, pain management protocol chart, on your phone, always available, or on a sheet of paper that you have somewhere that you can pull out. Because as we all know, when the pain becomes intense, it's hard for us to think about what to do. So having this chart available, you figure out, why is it hurting right now? Why is it so intense? What was the trigger? Number 2, what's it on a scale of 1 to 10? If it's a 6, you pull out your chart, check your phone. What did I say I do when it's a 6 to bring it down to a 5? And again, remember that this protocol chart is always evolving. You're going to learn of new things to add to their list of pain relief mechanisms or strategies. So I hope that that serves you in hopefully helping you to deal with your pain or any future pain